Hi there, I'm Janelle Hahn, the Executive Director for your local American Lung Association, and we are back here with AdventHealth, and we are in April of 2022, and April is a really special month when it comes to organ transplantation, and it is actually Donate Life Month, and I'm really excited to be sitting here with Dr. Linda Bogar of the Transplant Institute to just chat for a few minutes about Donate Life Month, and especially for our constituents who are very interested all the time in learning about lung transplantation. So I'm going to kick it off to you, Dr. Bogar. So it's Donate Life Month, which is really exciting. It's a really important month. Can you tell us a little bit about what it's about?
Sure. So Donate Life Month is typically every April, where we celebrate the past, present, and future of transplantation. So we celebrate the donors that have come already and have given their organs and tissue for our recipients. We celebrate the present by going out and talking to people about organ donation and about how to register as an organ donor. We also encourage people who do register as an organ donor to tell their families, tell their friends, so that they know their wishes and that they're more likely to not have any issues when it comes to donation that they had requested. Also to drum up their family and friends to go and register as well. We also look forward to future innovations in transplant, anything from the EVLP lung machine that we're using to travel further distances to get the lungs, to new immunosuppression medication that may be coming along. So these are the things that we celebrate in Donate Life Month.
That's fantastic to hear, and I know with us being the American Lung Association, we have a lot of constituents who are always asking about lung transplants. So can we maybe talk a little bit about what are some of the types of patients and disease states that you see, especially around lungs?
Right, so we see a variety of different patients that are in need of lung transplant. COPD or emphysema patients, cystic fibrosis, which is a genetic defect that sometimes, people need a transplant in pediatric age, but a lot of times these people now, with better medication and better treatment, they're living into adulthood and needing the lung transplant as an adult. We see patients with pulmonary fibrosis, all different types. And now, of course, COVID has become a big reason that we're transplanting lungs.
Yeah, absolutely. That's been a hot topic, a big question in a lot of cases. So, with the American Lung Association, we of course have our Better Breathers Club network. We have a lot of resources out there for lung disease patients. So for those patients that are questioning, is transplant the right thing for me? How would they find the Transplant Institute? How do they get in touch with you all to ask those questions?
Right, so an initial consultation is usually done by our transplant pulmonologists. So our medical doctors who know the disease process very well and can walk them through whether or not they're at that stage to need a lung transplant. So once the patient is seen by our medical pulmonologist and determined that they probably are in the window for lung transplant, then that patient will be seen by the whole rest of the team, including one of us surgeons, the dietitians, the financial consultants, social workers, and our coordinators. And then we decide whether to actually put the patient into evaluation. And when we put the patients into the evaluation stage, that involves a lot more testing that needs to be done, because certainly most of the patients don't come to us with all the testing done that is required. So then we will get all the tests, and then we, as a team, talk about and present the patients and decide, number one, whether or not they are sick enough to have a lung transplant, whether the lung transplant would benefit them, and whether they are an acceptable candidate based on their medical issues or maybe prior surgical history or other issues that they may have.
That's all really fantastic information, and especially, we sometimes have folks approach us who say, well, I have COPD, and am I eligible for a lung transplant? And there's so much clearly that goes into it, and you all at AdventHealth really take a very well-rounded approach when it comes to the dietary side, the mental side, financial, of course, and really looking at the disease state. So that's all really fantastic information. So with that, is there anything that you would like to add about Donate Life Month or anything else on this topic?
Well, I'd just like to remind people that, there are people dying on the wait list every day, and that one person, one donor can save 8 people's lives as an organ donor, in addition to the tissue that they can donate. So it is a good time to think about that and to encourage, yourself and others to donate. Living life after a transplant is not always easy, but most of the time, our recipients have no other option. And so it is, a good option to have, and we can't do it without donors.
Absolutely, and at the end of this video, you will see a slide that shows you some information on how you can learn about organ donations and how to sign up to potentially be an organ donor, and some other resources on how to reach the folks here at the Transplant Institute with AdventHealth, and of course the American Lung Association's free resources as well. So if you have any questions, feel free to reach out to us. A big thank you to you for taking a few minutes out of your day to chat with us on this important topic.
Thank you.
And again, I'm Janelle Hahn from your local American Lung Association. Remember, when you can't breathe, nothing else matters.